So let's get started talking about siblings. And I'll give a little background on siblings, and then I really just want to dive into your questions. So the sibling relationship is probably the longest relationship we have in our lifetimes. And it's very important for kids to learn how to work things out on their own between each other. And the conflict between siblings is not only difficult for them, but it's also very painful for us as parents. When we're talking about sibling conflict, we're talking about themes of fairness, inclusion and exclusion, competition and avoidance. For the non-ADHD sibling, sometimes there are issues of embarrassment. Why is my sibling acting this way with daily meltdowns, school struggles, etc.? Frustration. How come they have these annoying behaviors and they don't respond to my requests to stop? And guilt. Why does my sibling have challenges and I do not? Sometimes the non ADHD sibling feels a lot of pressure to be the good kid and to be different from the ADHD sibling and not cause the family any stress and to avoid issues. I grew up in a family where I was the non ADHD sibling, as far as I know. Um, very challenging for me, and I talk about that in the introduction to my book. That I saw my brother struggle, I saw my parents struggle with my brother, and there wasn't a lot I could do about it. In fact, mostly what I tried to do was to really just be as perfect as possible so that I wouldn't get caught in the melee, which had its own psychological ramifications, of course. We'll talk a little bit today about twins as well. Now, for the ADHD sibling, often they may have a very large presence in the family, and they are the focus of worry and concern. Parents may be more engaged with this child and take this child's side more of biological challenges. Sometimes there's jealousy or envy of the sibling with their ease with school, sports, or socially. And there's a difference between jealousy, I'm jealous of my sibling, I want what they have, versus envy, I want what they have, and since I can't have it, I'm going to destroy it for them. And so then you can't have it. There may be anger or rage at feeling less than. So let me turn to the chat right now. And what I'd really like to do is hear from you. What are some of the challenges that you're facing in your family with siblings, or either of yourself with a sibling or um, uh, with your children? So let's see, Lynn, you're a fraternal twin and you've been re-diagnosed. Lynn, you're saying that ADHD inattentive. My twin did not. She and I never got along. She is the perfect one. I was always the one in trouble. I do not believe that I believe that my dad was ADD, but no one ever said. So please take a minute now and write in the chat, what is the relationship between your kids? Um, and what are the challenges you're having with that? Or what is a relationship you have with your sibling who may or may not have ADHD? Or if you're the person with ADHD, what that's like. Lynn says, my twin did not struggle in school and I was always grouped with her friends. My mom never let me have my own friends. Very structured life at home, at her home. Okay, so let's hear. Tina says both boys are very reactive toward each other. It's great if you can say the ages of your siblings because that will put things in a developmental perspective for me. I'm working with an interesting client who is they're fraternal twins, and my client actually has transitioned to the gender of the twin. My client had ASD, which was not diagnosed, and ADHD, which was not diagnosed until they went to college. And throughout school, they were always compared to each other. They were both musicians. They were both bright, but the sibling had an easier time at school because they didn't have ADHD. And the self-esteem effect on my client has been very serious, although she's now doing much better. Joelle, and both of my twins have ADHD and they are identical. So when you have kids with ADHD, two kids with ADHD in a family, they may or may not have the same kinds of ADHD or the same kinds of challenges. And you may feel as a parent very stretched very thin. Tina, boys are 15 and 17, both have autism and ADHD. Jamie says mornings are difficult with my boys. Before my oldest, age 9, um, before his medicine kicks in, he's obnoxious. Wow, that's tough. He picks on his little brother, age 5, which causes my youngest to lash out many times physically. Right, so when we have a difference of 4 years, my kids were 4 years apart, the older child can really run physical and psychological and sometimes, mental circles around the other child. And the younger child can only keep up by being physical back, biting, kicking, etc. Um, Haley says, my ADHD son is teaching my 19-month-old swearing. Any advice? Also, 9-year-old daughter not understanding and thinking she isn't wanted due to lack of attention given. So, Haley, what I'm sure your son thinks it's hilarious when your 19-year-old says some curses. So, what I would do is sit down with your son and say, okay, look, here's a word that might be marginal, like shoot, that we could teach the baby, but we can't teach this word. It's just not appropriate. So let's come up with some phrases that we could teach the baby that would be funny and fun together. And in terms of your daughter, I think that it's really important in a household of kids, whether they have ADHD or not, to have time alone with each child. And if you have an ADHD child and one child who does not have ADHD, then it's really important to make sure you get some private time with both kids, particularly the non-ADHD child who may feel like, in your case, Haley, that they're not that important, or may feel like they have to be perfect, in my case, to get attention. And by the way, I'm not perfect. I'm a recovering perfectionist. Um, as someone once said in this live. Sarah, my non-ADHD child, age 8, likes to trigger my child with ADHD, who's 10. She knows he is easily upset by small things. How do I get her to stop stirring the pot? I think she does it to get my attention since I put a lot of energy into my ADHD son. I would probably agree with you, Sarah. And I think that what we want to do in situations is make times to give the non-ADHD sibling attention in a way that they want. Maybe, every Saturday you just take that child out for breakfast, or you go to Starbucks once a week, just the two of you, or something that makes them feel like they're important, that they're a little special. Because what happens is in a lot of families, when there's a child who has challenges, a lot of the family attention goes to that child, and therefore the other child feels somewhat neglected or frustrated. Um, okay, Stacy, I don't have enough time. My non-ADHD child feels neglected. She has two ADHD brothers. I don't always, I acknowledge her feelings, but I don't always have enough time or enough of me to go around. I feel terrible about it all the time. Well, Stacy, I hear you. And I think feeling terrible about it is natural, but it's really just it's gonna weigh you down and keep you up at night and make you feel guilty. It's not going to actually provide solutions. And so what we want to do is divide your time or use your time more effectively and efficiently. So in that situation, what I would encourage you to do is really make some time every day that is your daughter's time. It's just her time. Maybe the boys can be on their computers or gaming or something else, and then that's your time with her. Maybe you work together on a project around the house, or you cook, or you run some errands, but you're together with her and she feels like she's separate from them. I understand how busy you are, and I know it's hard to find that little extra bit of time, but I'm sure you can do that. Lynn, my children, girl and boy, were very loving to each other. I think the boy may have ADHD but never got diagnosed. He got cancer and passed away in 2014 at age 14. Lynn, I am so sorry to hear this. I think you've mentioned this a few other times, and It's heartbreaking for me, for you, and I truly am very, very sorry about that. It must be very hard for your daughter as well. Lori, my kids, 17 and 15, do not get along. They don't want to breathe the same air. The 15-year-old is the one with ADHD. The 17-year-old is irritated easily by his sister, and I believed embarrassed by some of her antics. So we can't force our kids to get along. Much as we would like them to get along, we cannot make them get along. What we can do is try to facilitate some family activities that are on neutral ground. Maybe to go and to go for a hike, or go play some mini golf, or go swimming at a lake, or something where you're all together. Um, and then I would really try to work on sitting down, maybe facilitating conversation where your 17-year-old can tell your 15-year-old the one thing that she does that super drives him crazy, and she could work on that. And she could tell him the one thing that he does that super drives her crazy, and he could work on that. Tina says self-esteem is very low for one of them. Lori, my oldest is 15 and has ODD and ADHD. Marika, my 14-year-old ADHD and 17-year-old brother doesn't believe, struggles because of younger brother, constantly fighting. So, kids are not necessarily going to understand the level at which I'm explaining sibling relationships to you. Their sibling is annoying. They're judgmental. They want them to go away. But there's a whole unconscious level to sibling relationships that's worth talking about, which is that they do grow up in the same household, and they have a shared history. And even if they're not getting along now, there are times, I bet, in your family where things are okay enough. What are those times? Put in the chat some times when your family gets along well enough. I'm sure there are some of them. And let's kind of zoom in on those so we can do more of them. And I want to hear what those are for you. So what are some times when your family gets along well enough? My daughter, ASD, ADHD, age 10, targets her younger brother, age 5. If something doesn't go her way, he gets punched, kicked, shoved off a chair. She swears uncontrollably at home, but not at school. She self-harms when anxious. Susanna, it sounds like that's really tough. And what I want to say to you is that when when the older or younger sibling has ADHD, they're frustrated with themselves. They don't have the executive functioning tools to manage things in their lives the way they would like. And so what they will do is target a sibling, either through criticism or physical acts, to make themselves feel better and to get out those negative feelings. We want to help them have another way of getting those physical feelings out. Is there a basketball hoop? Is there, do you have a treadmill or an indoor bicycle? Is there a trampoline in your yard? What are other ways to take that energy and get it out that isn't on the sibling? I also hope that she's seeing a provider and perhaps getting some medication and some therapy for her anxiety and her frustration. Krista, my son 9 is ADHD and ASD, and my daughter 6 is neurotypical. And I've been finding she's always trying to make things better, lessen the conflict, and people please for everyone. I did this with my younger brother growing up, which I know has brought a lot of issues for me. She's overly accommodating, and I worry she's dismissing her needs. Plus, she's always in the line of fire when my son's lack of spatial awareness, with my son's lack of spatial awareness and outbursts. So, Krista, it's lovely that you can identify with your child, and it's so important. And I think that, one of the things that you want to continue to say to her and to point out is it's okay to be frustrated. You can't make everything better. Your brother is who he is. Let's go out and do something on our own. What's it like for you when he acts that way? What do you do with your frustration? So we want to help her create some outlets. She may not talk about it, but maybe she could draw it, or maybe she could write it in a journal or do some art, which is like drawing, but maybe a different kind of art. So some way that she's actually getting it out. And to encourage her when you see that she's upset or frustrated. It looks like to me that you're getting a little upset. Your face is red. What words could you attach to that? Rain says all of our children, 19, 15, and 10, have ADHD of varying severity. There's a lot of jealousy, anger, and competition between the eldest and youngest, both of whom have mental illness. All three are very reactive to each other. I have ADHD as well, so I don't always handle things as well. I bet you're doing the best you can with the tools and resources you have available to you. And what I want to say is in a house of three children with ADHD, there's a lot going on. Okay. And yes, there's anger and jealousy and competition. Um, all you can do is continue to reframe for your kids and point out, you know, what they can do well and where they have challenges, and that we all have strengths and challenges. And it's natural to want to be able to do or have something that someone else does. But you have ways in which you can do other things. You're not going to be able to resolve the jealousy. That's an internal thing that they'll have to come to terms with. But you can point out that they have their own strengths and ways in which they're doing well themselves. And even if that way that they're doing well is how they pet the dog, pay attention to that. Okay. Um, Younger ones come off as the older, more wiser, trying to keep the older sister on track in daily life. Yes, so when the younger child does not have ADHD, what happens is that the maturity level and the executive functioning skills are from the older child can often be very similar to that younger child. And in some ways, the younger child can seem more mature than the older child. And the older child knows this at some level, sees it, picks up on it, and it makes them feel bad. So what we want to do is to come up with programs in the family like morning routine. You do this, but we all have a morning routine. And that levels the playing field a bit. And same with bedtime or other tasks. Erin, can't get along, can't stay away from each other, 7 and 10. Oldest has ADHD in attentive type. So, right. So this is the thing about siblings. Think about yourself. We clash, we come apart. We clash, we come apart. And I think that there's sort of a cultural message that we should get along with our siblings, that our siblings are people who, that's all we have when our parents die. We're only going to have our siblings. And I don't know about you, but in my work and in my life, I come across people who do not get along with some of their siblings. It's harder if you only have one, of course, and it's better to find some common ground. And maybe, what we want to think about is not that you have to be best friends with your sibling, but you need to get along well enough. What is well enough for them and what is well enough for you? Because your sadness, your frustration, your grief that they don't like each other better is yours. You can facilitate activities where you're working together and where you are showing enough love for everybody, and you can't make them like each other. You can tell them it's important, but you cannot make them like each other. And that is one of the most frustrating things, I think, of being a parent of more than one child. Marcia, my 7-year-old daughter has ADHD. My 9-year-old son and 15-year-old daughter are easily annoyed with her when she has episodes. That's fair. So what would it be like to say, you know what? It makes sense that you're frustrated when your sister's having an episode. What can you do to remove yourself and take care of yourself when that happens? What can you say to yourself? Telling her that she's wrong or bad or stupid or annoying is not going to help reduce the episode. Let me deal with the episode and you deal with whatever we decide would be an alternative plan. Judy says, I was diagnosed at age 40 with ADHD. My sister is more of a Martha Stewart with really strong opinions. I understand that some of my habits are annoying, but we are like oil and water, or more like gasoline and a match. I've wondered if she might be too and is overcompensating for it. Regardless, we still drive each other and my mother nuts, and I am gun shy around her. I wish it weren't so toxic. Judy, my heart goes out to you. I have so many people I've worked with over the years who have a toxic situation with their siblings. And really, as an adult, you do have to protect yourself. So you can be with her in the way that you can be with her, accept that, and stop trying to be something else that you're not. It's sad. There's grief in sibling relationships. I've had grief with my brother, and he's had grief with me. And we can only do what we can do. Christy, we have a 6 and an 8-year-old. 6 is more on the hyper side, non-medicated, and the 8 is medicated, more on the inattentive side. Throw in my combined ADHD, and whew, I feel like I'm not letting them be independent enough, but if I don't supervise the older one, distracts the younger. So, there are ways in which to engage your children, to supervise your children, and you also want them to be able to learn tools to work it out with each other, because at some point in their lives with their peers, or later on when they're adults, they'll have some relationship that doesn't include you. Sibling relationships are our first peer relationships of a particular kind, and that is, basically present all the time. So we want to teach kids how to resolve conflicts, and initially we're involved in that. We may have to step in and have one person speak and the other person listen, and the other person speak and the other person listen, and come up with some sort of compromise where no one's happy, which means it's a good compromise. And eventually we want our kids to try to figure out how to do this on their own. Safety is the number one concern in families where there's more than one child and they're not getting along. What are the rules around aggression in your family, around name calling? And what are the consequences for that? I really like the intervention of what I call cup of consequences. So you sit down with your kids and, you put down, what are some things in the family that we're not going to do, or we would prefer not to do, or aren't really helpful. And, when there's an issue, you can pick a cup of consequence. A consequence can be helping me with the dishwasher. A consequence could be reading to your sister a book of her choice, who is younger and struggles with reading. So really think about ways that they could build a relationship. When an older sibling, even a sibling with ADHD, can do an activity with a younger sibling that matters to the younger sibling and is easy for the older sibling, that can build self-esteem and the relationship. Joe Ellen, my twins get along really well. They argue about singing in the car. One would want to sing, and the other would be bothered by singing. This happened in the youth. They're now 19. It happens that way. I mean, that's part of how siblings and twins differentiate themselves. I want A, you want B. That means we're not exactly the same in all ways. And that's something that they can work on their own. They can figure it out. That's really normal sibling stuff. What I worry about is the sibling stuff that is really hostile and aggressive, and just puts people down over and over again. That's what my concern is. Lynn says, my sister was considered the oldest as she was a few minutes older. They were twins. She was the boss of me. I was the third wheel always. Found out that I really had no friends when I flunked out of college and was back home, and she went back to college. Never had any connection with the friends we had, only connection when my twin was home. That sounds really tough. I think that in twins, there can be a dominant twin, and there can be a twin who's has more ease with social activities, and friends than the other twin, in which case the twin may the more socially challenged twin may tag along, and so they're tolerated but they don't actually build friendships. So it's important with your twins to look at their social capacities and their friends, and to make sure that they have some independent friends. They can have friends they share, of course, but do they have friends that aren't the other person's friend? And that's really tough when they're twins, because they're in the same grade. They may actually overlap with interests, but it's important for them to have a play date where they're with their person and the other twin is with their person. So some sort of parallel experiences. Let's see, Joe Allen. I was a middle child, not diagnosed until 51. My older sister was the perfect person in the family growing up. I don't think that my ADHD affected her much. I'm a mom of three, and she lived in Australia and did really well in business there. My brother might have had ADHD as well, but he died at 32. Thank you for sharing, Joellen. Michelle asks, how do I deal with the 13-year-old ADHD picking and annoying the 16-year-old non-ADHD and the 3-year-old, especially the 3-year-old? These two can't be together for very long without the 13-year-old picking and causing chaos. It's hard not to yell and punish him because it causes so much chaos, but he just gets mad and hurt and storms off if he gets punished for it. So my question for you, Michelle, is does the 13-year-old actually know how to interact with the 3-year-old in ways that are not provocative? Because the 13-year-old may be struggling for how to connect and is provoking the 3-year-old because that is a form of connection, right? Anger, arguing, getting, tussling is a form of intense connection. So, what are other ways that they could connect that would be helpful? And you can, the part of the problem is, you're not going to be able to expect from the 3-year-old a whole lot. So it's worth talking to the 13-year-old and maybe limiting the time that they're spending together, because maybe the 13-year-old can be appropriate for 10 minutes and after that can't, and so if you're expected to watch a 3-year-old for or be with a 3-year-old for more than 10 minutes, that might be an unrealistic expectation. Chad, my second and third oldest both have ADHD. They are polar opposites. The older one, girl, is a germaphobe, and the younger one isn't much into personal hygiene and frequently gets berated by his sister. So again, we have to set limits about what is okay and what is not okay. The germaphobe is trying to teach the younger one, about personal hygiene, and perhaps some of those lessons are actually valid and appropriate, but really the person who needs to teach your son about personal hygiene is you or your partner if you have one. So I would encourage your younger daughter, the girl, to basically to come up with a few areas where the older ones, you know um, germs really affect her, and how you can modulate those one or two situations, and because then she'll feel like she has some influence and she doesn't need to put it, in every place all the time. Elizabeth, family game time. Both my boys, 5 and 8, love playing games, and that's something we can all do together and get along for the most part. I love that idea. Some kids with ADHD love games. Sometimes games can rev them up if they're not winning, but most of the time, a game can be something that we're all doing, together at the same time. And kids understand that sometimes they win and sometimes they lose. Linda, struggling to get the senior to go to his graduation, anxiety. Okay, so I need what exactly are you asking? Like, do you want him to go to his graduation? What specific things is he afraid of? One of the things about anxiety is we want to look at the process of the anxiety, not necessarily the specifics. But in a situation like anxiety, like graduation and having anxiety, I'd like to know what he's concerned about. Joellen, oops, we have tried to talk much more now that she has moved back to the States, but conversations are still strange. We don't have a lot in common. That can happen in families. It's okay. It doesn't mean you're a failure or something's wrong with your relationship. You're just different. And I think sometimes, we want our siblings to be more like us, and they're not. And that's a sadness. And so we have to turn to our friends for that closeness that we don't get, or our cousins or our partner or something else, like that. You're welcome, Krista. Lynn, my twin and I were totally different. She was the scholar and athlete. I was like the homemaker, crafter, babysitter. Well, in all the differences, since I live on the coast and my mother and twin live in Keene and they are hooked at the hip, my dad gaslighting to me, Took me until 2014 to realize this and gave me the benefit of the doubt. When Sam passed, I realized that I needed separation from them. When my dad died, so I no longer have contact. They both make no attempt. I'm sorry, Lynn. I'm very sorry to hear that. That sounds really painful. And that's another thing that I guess we should talk about, our family dynamics. So in some families, parents have a favorite. And they may not admit it, but it looks that way. And in some families, parents love their children equally, but one child just demands more of them. So it seems to the other child like that child is their favorite. And so what we want to do is balance that by increasing some quality alone time with each child, or particularly with the child who feels like they're left out. Fairness is a big issue in families, and it is an issue for most kids. And fairness doesn't mean equality, but rather feeling listened to and included in plans that are created for the family and in daily activities. Use incentives and reward charts for everyone, but expect different things according to different ages and abilities. That's what fairness is. It's not about who gets more and who gets to do what. Um, when you are responding to your kids with ADHD, your other children, when you respond to each child, your other children are watching how you do that. It's important for us as adults to practice self-control and figure out what helps us manage ourselves better when we're triggered. That way, kids can see how to do it themselves. Use humor. Keep your perspective, that zoomed out perspective. What's the big goal here? And practice compassion. Your other children will follow your lead. Christine, my 10-year-old twins and myself thrive on family treats earned based on kindness between the three of us. We plan ahead what the treat will be and they look forward to it. Awesome. That's fantastic. Dana, amen on that. I don't know what that was, but great. Basil, my sister is a doctor. She does not understand my diagnosis of dyspraxia, ADHD, and Asperger's. She does not understand my condition. Basil, I'm really sorry to hear that, because as a doctor, we would hope that she would understand that. So maybe send her some articles from Attitude about what these things are, and ask her to think about it with her doctor's hat on, not her sibling's hat on. Nadia, 6 and 9-year-old, eldest has ADHD. How can one introduce ADHD to the youngest? Are there resources? Is this age too soon? Should I not do this at all? So what we want to do, rather than label ADHD, which is kind of tough for the kid with it and for the kid without it, is to talk about different kinds of brains. You know, your brother has a fast brain and you have a really a drawing brain, and they're both fine. And they're both great and they're different. And so when you have a fast brain, you may do X and Y. And when you have, you know, an artistic brain, you may do P and Q. I think that we want to talk about the reality of what you're seeing in your family. So yes, your brother struggles with attention or loses his temper, because we don't want other kids to think they're inventing the problems that they're seeing, that they're not really there. So it's better to be honest and realistic than to deny things. Basil, my sister says we will never have a meaning relationship. Ouch. Basil, I'm sending you a big hug. I'm really sorry to hear that. I encourage you to look to other family members to have a relationship with. Thank you for the insight. There is grief for one another between siblings. Yes, there is. That's real. Caroline, how do you stop non-ADHD siblings resenting ADHD as they feel overlooked, as their siblings are so combustible and get hit when the older one loses control and the overwhelm? So I would really, really lay down some family rules and write them down and put them on the fridge or make pictures. You know, no hitting, or whatever, no biting, no kicking, whatever they are. We in this house, and I prefer something positive in this house, instead of biting, we use our words. Instead of kicking, we talk about our feelings, you know, so that and you know, there are the logical consequence for being aggressive is X, whoever does it. And that as it makes it very clear. And I think resentment, I mean, if we talk about what resentment is feeling a kind of anger and frustration and blame with a situation in which you feel powerless. So when kids are resentful of siblings, it's because they feel maybe a certain level of invisibility or powerlessness to change a situation to make it better. So I would really talk in the family about how we as a family are going to change this dynamic, how we as a family are working on this, so that there can you can instill hope. And I would figure out how to let your child who has the resentment talk about their feelings. You don't have to agree with them, but you can listen and you can say, I understand why you feel this way. That makes total sense to me. Um, Bruna, I have three boys, 14, 12, and 9, and the oldest and middle one are fighting constantly. My 12-year-old has ADHD and is very defiant and verbally aggressive. Older one is tired of him putting up with his misbehavior and name calling and upset that we let him get away with things. Please advise. So maybe I guess my question is like, are you letting him get away with things? You know, again, that goes back to the thing that I was saying is like, what are the family guidelines around speech and behavior? And what are the consequences for inappropriate language? You know, is there an agreement that you can make that when someone says something inappropriate, they get a take back of the day? Is there something that you can lay out that says when you say something really aggressive and the other person tells you that, you know, that tells you in a particular way, you have options. You can go to your room, you can go to the bathroom, like here's how you can extricate yourself. A lot of times things snowball so quickly in families that before we've actually realized what's happened, things have really gone awry. So we want to slow things down, you know, really separate and breathe and slow things down. I call that a time apart. So we want to do a stop, a time apart for a particular amount of time. Research shows it takes 15 to 20 minutes for the brain to sort of settle down after an amygdala hijack, that kind of outburst, and then come back together and think about like what happened and how we move forward, and then how do we move forward, and then that discussion about how we move forward, we do one of those things. That's the act. Um, okay. Hi, Michelle. Thank you, Lynn. How do you hold on to friends who are not challenged with ADHD? So I think the thing that we want to talk about with our friends who have ADHD or don't have ADHD is you know, is honesty about the fact that sometimes I do or say things that might be off-putting. I'm not always in control of that because of my ADHD. So just let me know if I've wandered off and I'll come back. Don't feel afraid or don't worry about hurting my feelings. I'm aware that I do have these challenges. Bruno, 14-year-old boy, very angry at 12-year-old brother with ADHD. Right, they're angry. The kids who don't have ADHD are often very angry at their siblings. They're angry at the attention that their siblings get. They're angry at the disruptiveness that their siblings bring to the family. Oh, our family would be so nice if it weren't for them, quote unquote. And they're angry because they can't make it better. Nothing seems to make it better. So we want to allow them to be angry without getting negged out on the kid. Now, at some level, you know, family therapy can be super helpful for this kind of thing. And we also want to allow the kid who's angry to have a place to be angry. And maybe they need to talk to someone on their own. Um, I'm sorry, Basil, that your sister doesn't understand. Yes, Susan, lots of twins today. Um, Definitely want him to go, but he seems paralyzed by the idea of the large group, the noise, and the attention. Okay, Linda, so here's what I'm thinking. Does he have noise canceling headphones or earplugs? Um, has he ever been in other situations with large groups? How did he cope in those situations? And can we bridge any of those coping skills to the current level of graduation? Um, And what type of attention would he be under? Because if he goes to a school and he just has to walk across the stage and get his diploma, you could practice that, and you could talk about what his major concerns are. Helena, thank you for, I had ADHD, but my sis, who was a mess, also with ADHD, super reckless, made my parents miserable. And it was for me devastating to see my parents so frustrated and desperate for answers. I understand that. So I turned into an OCD case and an overachiever in many aspects, something that brought other issues. After I was diagnosed with ADHD, I had a better understanding of our family dynamics, but after so many years of controlling my ADHD, it's still difficult to let go of control and accept only to be an expectation of disaster. Right? So it takes time for change, right? It takes time to let go of patterns. And particularly if you've been using patterns since you were a child, it's going to take a while. What is your replacement behavior? What is your replacement coping tool? We can't just release our coping mechanisms and have nothing instead. So I'd really encourage you to work with some to figure out how else you can soothe yourself other than through OCD behaviors. Thank you, Lynn, for saying that. Helena, I meant to say an expector of others' disasters. You're welcome, Bruna. So we have about 5 minutes left. So what I'd like to ask you is, as parents, what are some interventions that you've been doing that help your kids get along a little bit better? I'd like to hear what are some things that you're doing that are fostering positive bonds between your kids. It might be going out for dinner for pizza and ice cream. That's great. But we want to try to figure out what works in families and how we can enhance that. Because if we're only focused on the problems, as parents, we're going to feel terrible about ourselves. And that's not a way to live. So, what ways are you able to bring your family together successfully to help your kids get along? Please share in the chat some of those. And I'd like to hear, what is it that you're doing with your kids? Because this may be helpful for other people with their kids. Genevieve, I'm an early child behavior intervention para and want to further my career. Can you tell me what degree I should get? I can't do that right now, but we can talk about career issues another time, and then I'd be happy to do that. What I'd like to know is, what are people doing to help their kids get along? Because this is really important. I want to know what's working, because we can't build on what's working if we can't identify it. So what are some times when your kids seem to be okay? Someone talked about playing games. What are meals like? How about bedtime? Do you gather together and read a story as a family? Do you watch movies together? Christine says family outings bring us together. That's great, because you're out of the house, you're exploring, and you're not sort of looking at the challenges that are right in your face. What do other people do that help bring you together as a family? Jennifer, my kids are best on vacation. Yep, no pressure. They're just hanging out. They're able to be together. Lori, my 17-year-old is very good at math, and he will help his 15-year-old sister when she needs assistance. Whoa, that's awesome. Algebra left my brain years ago. They actually do get along during those times. Isn't that fantastic? So your 17-year-old can be an ally, can be a role model, can assist their sister. And this really is important, because that's the foundation of a connection that could develop over time. You may not see it in the house while they're still there, but it may continue later. I love that. Bruna, cooking together, movies together. Yes, food-oriented things, entertainment-oriented things. These can bring families together. Maybe one week, one person picks the movie. Maybe another week, another person picks the movie. You can put down a bunch of activities that everyone loves to do and put them in a bowl and pick them out and say, hey, we're going to do this today. Um, that can be fun. You can have a magical mystery tour where you're going to go someplace, but you don't know how or what you're going to do when you get there. I think we're shaking things up a little bit in terms of routine, of daily, the mundane daily activities we do can really shift how kids see each other and how they relate to each other. Rain says family-based therapy, family dinners, play board games, try to have time where only two of them are together rather than all three. That's a great idea. Sometimes the divide and conquer model can really help reduce conflict, but also allow kids to feel more personally connected to each other or their parents, of course. Um, so I'd love to hear from a few more of these wonderful suggestions. I'm really loving them. One thing that can be, really helpful is sometimes sending one child off to be with one like grandparent if they're nearby, and another child with you, and then switching. That can be helpful too. Um, let's see, Bruna, running races together like 5Ks. Oh, that's awesome. Middle was encouraging the youngest at the finish line. Woo! I love to hear that. Marcella, my kids get along well when they are doing things they are interested in, ages 5 and 7. Yes. So your kids can do things that they're interested in separately, but in the same space. That's a win. I really think that's a win. Um, because they're actually, that's building tolerance for each other, and it's also building, connection. We don't have to all do the same thing, but we can be together when we do it. So I'll take one more question or comment, maybe a couple more. B, since we're still in lockdown here, we play family volleyball together in the backyard daily. Oh, I really love that. That sounds fantastic and fun. When we can inject the fun factor into our families, the tension in the relationships, in the sibling relationships, may well decrease. Um, Kids act out their stress, their anxiety, their depression, their frustration on each other. And so if you're in a different environment, whether it's a vacation or playing volleyball, they're outside of themselves in a way, their typical selves, and they might be able to get along better or rise to the occasion. And finally, Bruna says, ADHD does not know how to lose and fights everyone, even neighbors or friends. So one of the things that I do with kids who have trouble losing is I teach them how to play Sorry. It's a board game. And what I like about Sorry is that you have to make contact with what I do when I play with in my office with kids is I have them make contact with me when they say they're sorry, and I have myself make contact when I say I'm sorry. And so when we get to the end of the game, you can sort of see where you're going. And I talk about what it's like to say you're sorry and to relate that to maybe not winning. What do they tell themselves when they don't win? What negative thoughts are they saying? And probably what happens with kids with ADHD who lose and are very angry losers is it's just another way that they failed, that they haven't measured up. And we need to keep kids understanding that trying and succeeding and losing, it's all part of growing up. You're not supposed to win all the time. You're welcome, Stacy. Lynn, thank you so much. Yes, I bet she does. That sounds so hard. Um, yeah, she's on meds for depression with therapy, but refuses to talk about her brother. She's adulting it now in Pennsylvania and a mechanical engineer, but still having difficulty. I've asked her to see a therapist about ADHD. She's smart, but socially she's struggling. The loss of a sibling, the loss of someone is so huge for kids. In my community, which is a small community here in Western Mass, we've had, I think since COVID began, a number of suicides. And the siblings it's devastating. And I knew the families of a couple of these young people who killed themselves. And I think it is a lasting scar. And I hope that your daughter gets help to talk about it. It's hard to make friends when you've lost someone that matters so much to you because you don't know if that loss could occur. And that happens to kids I know whose friends have died, and it happens within families when a sibling has died. It takes time and to rebuild trust in a relationship. So thank you so much for joining me today. It was a great pleasure to be here. I really want to encourage you to check out my website, www.drsharonsaline.com, where I have a few articles on sibling relationships, and to like me on Facebook. I'd love to be your forever friend. Have a great day, and I'll see you all next week. Thank you.